Dr. Aaron Baggish, Director of the Cardiovascular Performance Program here at Mass General. Well, Mass General's Cardiovascular Performance Program was the first of its kind in the nation. It was really set up to be a one-stop resource for athletes and highly fit individuals with either cardiovascular disease and risk. Our care model here at the Mass General is firmly rooted in science, but also based on many years of experience. And we provide a robust tertiary care referral center for athletes and the doctors that work with them when complex problems arise. We're collaborating with other investigators that bring novel techniques to research questions, but as importantly, our collaborations involve the people we study. So we work closely with many local clubs and teams that provide us with the opportunity to work closely with their athletes, and we consider collaboration something that is fundamental in all the work we do. So the million-dollar question in the sports and exercise world is the degree to which COVID-19 infection has a lasting effect on the heart muscle that could place athletes at risk for bad outcomes when they return to the sports field. And the diagnosis that we're most concerned about is myocarditis. So what we're really working to figure out now is the degree to which young, healthy athletes that were infected with COVID but not sick enough to come to the hospital harbor a risk for myocarditis that would be of relevance when they return to the playing field. So we're still premature to make any general conclusions. We are seeing cases of athletes with heart injury, and yet we're seeing far more that had COVID infection and recover completely. So our preliminary look into this question is that it will be a small minority of people affected, and those that are affected will need rest, recovery, and attention from the medical professional community. We're really hoping to understand whether or not COVID-19 has cardiovascular complications that would not just be relevant to athletes returning to competitive sports, but to routine folks that are interested in returning to the gym or the recreational activities that they enjoy on weekends. So right now, in partnership with colleagues at the University of Washington Seattle Sports Medicine Division, we have launched a nationwide registry in which we're looking at all NCAA colleges and universities that opt in to participate in an attempt to capture as many COVID-positive athletes as possible returning to sport and looking long-term at what outcomes they may show us. Our non-COVID research is really quite diverse. We do everything from small-scale human physiology studies in our exercise lab to larger, more broader epidemiologic look at how exercise and fitness affect health outcomes across populations.